This conference will now be recorded.
Good afternoon, everyone. I'm Julie Kalkbrenner. I'm one of the physician liaisons with Lurie Children's, and I cover the west and northwest suburbs. Today, I'm delighted to introduce to you Dr. Aaron Gossain and Dr. Akira Yamada. They'll be talking about our plastic surgery program here at Lurie Children's. I would also like to encourage you for this lecture, if you have any questions, please feel free to use the chat box, or we can open this up for conversation at the end of the program. Thank you, and here's Dr. Gossain.
Well, thank you for joining us at your busy lunch hour. But I just wanted to introduce our division. We're a division of 4 plastic surgeons focusing on pediatric issues in plastic surgery, and I've listed them on this opening slide here. The abnormalities of the breast, including congenital anomalies with gynecomastia in males and macromastia in developing females, burns, chest wall deformities, including pectus excavatum. We work with the cardiothoracic team on those. Cleft lip and palate is one of our large multidisciplinary clinics where we work with ENT, speech therapy, orthodontics, and a number of specialties to give comprehensive care. Cosmetic surgery in adolescence is something to consider, including rhinoplasty. Dr. Yamada is going to update us on ear deformities, for which he's a world expert. Facial paralysis we'll speak about this evening for dynamic reanimation of children with facial paralysis. We make a lot of these diagnoses at birth with cleft lip and palate, craniosynostosis, hand and upper limb defects. A lot of this can be seen in utero, and we can actually see you even before birth, the born, to help educate families. Head shape anomalies, most of them are often positional, but we can help to distinguish those from the suture fusion in conditions. The vascular anomalies, including hemangiomas, vascular malformations, we have another multidisciplinary team focused on that. Jaw deformities that often take place in children with some of these congenital craniosynostoses is something that we also focus on, as well as tumors such as neurofibromatosis, large nevi, children with syndromes, Aperts and Cruzons you may have heard of, Nagers and Treacher-Collins, those types of things. We have the skeletal conditions to treat those. Torticollis, if it's refractory to physical therapy, is something we can also help with. And so we've listed those things just so you know what the breadth of pediatric plastic surgery is. Now we're going to focus on one area with Dr. Yamada on microtia or ear anomalies and reconstruction. Now, Dr. Yamada is a leading authority throughout the world on ear reconstruction, has trained in Japan, is now a full professor here at Northwestern University, and is recognized nationally and internationally for the work he's done. Is very creative, and what's really the strength of Dr. Yamada is his ability to teach these principles. A lot of masters of surgery can't teach, but Dr. Yamada has made an effort for these teaching programs, and I'm going to let him take it over.
Thank you very much, Dr. Gossain, for a nice introduction, and appreciate Chad, Julie, thank you for the help. So the time is limited, so I'm going to talk about the ear reconstruction in brief time. Otherwise, I have to talk all day to explain everything, but I'm going to show you some cases I do and which can be done. And the spiral key is a key, spiral curve. So the ears, the rodent, beautiful. So my talk is summarized in the Best Plastic Surgery book, Plastic Surgery, the 4th editions. And so the spiral curve is a source of beauty. And the spiral is the beauty fractal. And the ear shape has spiral curve as seen here. This is a 3-year child, dog bite. And so this is a view pre-op.
Excuse me, Dr. Yamada, your screen is not showing. Can you show your screen, please?
Oh, what is it?
Just the share screen button down at the. There you go.
Okay, all right, I got it. Okay, so maybe I'm gonna show it from there. Okay, so now you see it? Can you see it?
Yes.
Okay,
Yes, sir.
Good. Okay, so this is we just talked about the spiral curve, like a notice, and the spiral curve is a beauty. It's called fractal in mathematics. and the ears has the shape of spiral curve. So this is a 3-year-old child who had a dog bite by pit bull, and the upper portion is missing. So what I did was quantify the missing of the cartridge. This is the degree of the cartridge missing. So this is the pre-op design on the table. Harvesting rib cartridge, 7th rib cartridge, and create the partial framework based on the template, and cover with the fascia flap. It's called temporal palate fascia. So it was transferred to the ear side, and the ear framework was fixed and covered with a fascia flap and the skin graft on the scalp. So this is a sequence of the surgery. Both the sutures for 2 weeks, 1 week post-op, and 2 weeks post-op, and this is 3 years post-op. So he's very happy, and I'm very happy, and Dr. Gosen helped me for the second surgery. Pointed ear is not well accepted in your society. So this child was bullied every day at school, which is not acceptable. But we have to change the shape to avoid the bully. So what I did was the sutures, oroplasty approach, as well as the this is a difference from the normal shape. You see the acute curve. So this is a deformed the upper helical rim, and this was made a cut to expand and see the difference between two. And using the rib cartridge, create the helix portions on the fixed. And this is the immediate post-op, pre and post-op, and compare with the template. And this is both the sutures again. So this is 2 weeks post-op. Look at his eyes are shining. He's with a hope. So you see the difference between the left and right. So another side, same way. This side is a little bit more simple with an oroplasty approach and both the sutures, and this is the outcome, pre and post. Microtia is a small ear, and child has only one chance to obtain the best outcome. So primary surgery must be perfect. Timing of surgery, 10 years. Chest circumferences at the lower portions are over 60 centimeter. I use a rib cartridge because it's a 60 years follow-up and the proven sustainability for the rest of your life. And but it's a demanding surgery, but easy to deal even with the infection. In the infection, they mostly localized, so we can deal with. As opposed to the if you use a plastic ear, you have to take it out. 6 to 9 rib cartridge without perichondrium. So this is the framework I created. So I show you 1 minute video how I do. This is the 6th and 7th rib cartridge. Create the base frame and the curving. And this is the 8th rib cartridge for the helical portion, creating the spiral curve. You see, make it flexible, and going from the downstairs to going upstairs, making the spiral curve. That's the key of the surgery. And the small piece behind the frame. And this is the nice rib cartridge creating the internal the structures, anti-helix portions. Curving. The last portion is the helical, the tragus portions. Tragus is also important to create a shadow. Look like there's a shadow. Look like a ear canal. So that's it's making the shadow. That's this is the framework I created, and the separate table. So this is the patient pre and post after the 1 stage operations. It's another child, pre and post. It's another child. This is the child I did in Russia. This is another child. Another child with a concha type microtia. This child I did in Oman. This is a child with a Treacher-Collins syndrome patient, the more complex. It's another child. It's another child. So this is a recent case I did. This is another child recent case I did last year. The more complex patient with a low hairline. It's more complex patients. So this is the framework I created from the rib cartilage. A bilateral small concha type I did in the Cleveland and Rainbow's baby with Dr. Gosain. So this is another child in Oman. It's another child redo case. I have a 10 years follow-up, maintained very well. That's another reason I use a rib cartridge. 10 years follow-up. He's at the top medical school now. You want to be a surgeon. So this is 7 years follow-up. So maintained very well. And microtia is associated with the craniofacial deformities. And this is a child with a microtia with a hemifacial microsomia. So anything I can do at the child? Yes. Fat grafting to the face. So area is better, more chance of survival of the fat. So this shows the 4 years follow-up after the fat grafting for the Treacher-Cohen syndrome patients. So I use the same principle for this child and the microtia with a smaller face on the left-hand side. So this is the 3 months after the fat grafting. You see the change with the small operations. The family are extremely happy with the change of the face. So microtia is, I recommend no surgery until the first surgery at the age of 10. That makes the best result. Rib cartilage works better than the plastic ear, as far as I'm concerned. Chicago, frozen Chicago 2 years ago. It happens now. Ear molding. Talk about the ear molding. Ear molding is we can do change the shape. Started in 1984 by Matsuo, my friend. Here's a Matsuo. He has a lot of good idea, including the osteal stent was also developed by himself. So it's work best for the started 3 to 6 weeks of age, and over 3 months of age, not gonna work very well. So this is an example of the ear molding. If you have adhesion between helix and antihelix, the ear molding is not gonna work very well. So I don't recommend that. Star ear is one of the good indications. And place the molding, taping in 2 layers. This is 4 weeks post molding, so it works wonderful. Another star ears. So another star ear. This is a leading deformity, and this is another leading deformity. Prominent ear is works sometimes, but not always. So if the child has a very flexible ear, I may do it, but I may not do it. Depend on the flexibility of the ear. Constricted ear is another thing that somewhere between microtia and the normal ears, and the upper portion of the helix is skin deficiency as well as the cartilage deficiency. So the Tanzer and the father of the modern and the reconstruction proposed this. This is a group 1. Constricted ear on the right-hand side. So this is a post-op. It's a little bit more smaller operation they can do to change it. So this one I show you previously, the same constricted ear, more severe one. It's a group B constricted ear. Hemifacial microsomia is interesting and very, very extensive tissue defect, including the bone, muscle, soft tissue, and the skin. And associated with a microtia, and it's more complex, low hairline, low set lobule, possible vascular anomaly. So this is the microsomia type 1. So I did, type 1 is more simple and easy to get the best outcome. Type 2 is more complex. So what I did was the skeletal correction first to do destruction osteogenesis, and preserve the teeth and put and elongate the mandible. And at the second stage, I did ear reconstructions. And this is the design of the skin dissection. This is a framework, immediate post-op. And this is the 2 weeks post-op. And this is a 1 year post-op. So the associated hemifacial microsomia is more complex. We had to do the skeletal work as well as the microtia reconstruction. If the child comes with a bad outcome from other place, it's also possible to change. So this is the burn and 95% missing auricle because of the 3rd degree burn. And normally people do recommend the prosthetic, but we can create long-lasting autogenous reconstruction as well. But I have to have a very, very complex operation to do it. 12 hours operations. Create a huge fascia flap. So this is a cartridge framework with the triggers. This is a sequence of surgery, placing the cartridge framework, covered with a fascia flap and the skin graft from the scalp. And the bolster suture again. 1 month doesn't look good. 6 months have a nice definition. So the second stage, using the other fascia layers, the deeper fascia layers, with the cartridge to elevate the ear, and the cover with the fascia flap and the skin grafting. This is a final outcome 8 years post-op, maintained very well. The last case I'm going to show is a trauma case, a complete missing because of traffic accident. At the first stage, I did the vascular the reconstruction under the microscope. At the second stage, I did again complex operations, and this is a partially calcified cartridge framework covered with a fascia flap and the skin grafting. This is the final outcome. So this is the last case. Sorry, this is the last case, the recent case. And so dog bite and complete loss. So what I did was the more complex, because the typical temporal fighter fascia flap is not available. So I did use the occipital fascia flap. It's a huge flap to cover the ear shape. This is the cartridge, and this is a framework, and cover with the occipital fascia flap, and then the skin grafting, and both the sutures. This is a 6 months post-op. So the ear reconstruction is all over the spiral curve. So we learn from the curve of the natural curve beauty. So that's the key of the ear reconstructions. All right, thank you so much for your attention. Any question, just let me know. Thank you.
Thank you, Dr. Yamada. That was excellent. You have
I have a question. What is the upper age of patients that you see?
Upper age, not no. And I'm going to see 69 years old gentleman come from Minnesota next week.
Oh,
yeah.
Wow.
Your work is extraordinary.
Oh, thank you.
Excellent. I do have another question that is coming. How much time between the rib cartilage extraction and how much time is there between that rib cartilage extraction and then the actual ear reconstruction surgery?
Oh, it's the harvest the rib cartilage, and right away on the table, on the separate table, I start the carving process. That's the best way, because fresh is the best. Everything has to be fresh.
And you showed us the 60-second version. How long does it actually take to create and shape the ear, like for the microtia?
You're talking about the duration of the surgery for the microtia reconstruction first stage?
Yes.
It's the total time is depend on the assistant, and but I think the average time probably 8 hours to finish, and the skin dissections 1.5 hours, harvesting rib cartilage 2 hours, and the framework and the creation 2 hours, 2.5 hours, and placing the skin sutures 1.5 hours, total 8 hours, and sometimes take a little bit more than that. So, but it was done in 1 day. The ear reconstructions used to be 4 to 6 stages. My approach is the 2 stages. And the first stage is to create the ear shape. Second stage to create the ear elevations. So 2 stage is much better than the 4 to 6 stages.
And do your reconstruction patients, are they admitted as inpatients post-surgery?
Yes, and so it's always fighting with the insurance company, but because of the pain, from the harvesting rib cartilage, and most of the insurance company approve for that. And mostly patient stay 2 or 3 nights and going home. And yes, inpatient.
Excellent. Okay, we have on this slide, we have Dr. Yamada's contact information, his office phone at Lurie, as well as his email address. And Dr. Yamada is also available through Rapid Connect or an Epic in-basket message.
Anytime, please call me, anytime.
Thank you. Dr. Gosain, did you have any closing comments? Oh, I think we missed him.
Yeah,
Okay, are there any other questions? If there aren't any other questions today, I would like to thank everybody for coming today. And then also this evening, we will be having our last plastic surgery discussion with Dr. Gosain talking about facial paralysis. So Dr. Yamada sees patients at Lake Forest, Lincoln Park, Northbrook, and Lurie Children's, and appointments can be made by calling 1-800-KIDS-DOC. Thank you very much. Enjoy the rest of your afternoon.
Thank you.
Thank you so much, Julie. Thank you, Chad.